Hello, everyone, and thank you for joining today. I'm excited to have you and excited to be here. My name is Derek Cohen, and I'm part of the support staff here at Transitions Benefit Group. I'll be presenting the Prescription Drug Plans webinar today. We also refer to it as PDP. We are going to go over a lot of information today, but no need to be intimidated by that. We'll present it to you in an organized fashion. Make sure you get all the information you need. Please feel free to get out the pen and paper and take some notes, and we'll go ahead and start jumping right into it. All right, so on this first slide, I just wanted us to kind of have an agenda of what we'll be going over today and share that with you guys. Um, First up, we're going to give you a brief introduction into exactly who we are and how we operate with the Transitions Benefit Group overview. Then we're going to jump right into it really with what is Part D and who is eligible. Then we'll talk a little bit about medication and formulary tier levels. Next up will be how are medications covered under the different parts of Medicare, and then what is not covered by Part D. Next, we'll do a little bit of education with IRMA. The high income adjustments apply to Part D, how Part D works. Then we'll go to cost savings resources, followed up by Medicare Insurance Direct, known as MID, and then we'll wrap it up after that. So, as I mentioned, here's an overview of the services we provide. So, at Transitions, we really offer a white glove service. We're in no way a call center, and we operate similarly to a financial planner. You can schedule an appointment by phone, email, or even using our easy to use online booking link. After that, an advisor will call you at that scheduled time to answer questions and help you plan for Medicare. Our offerings include Medicare coordination, Social Security planning, dental and vision options, COBRA insurance alternatives for individuals and family, caregiver support, along with valuable educational resources. So, when it comes to Medicare coordination, we understand the complexities involved in coordinating various aspects of Medicare, and we are here to provide expert assistance and guidance throughout the entire process. Then when it comes to Social Security planning, we know that determining the optimal timing to draw Social Security benefits is a common and important question for many individuals. So we specialize in helping clients navigate this decision by providing expert guidance tailored to their unique circumstances. Then, as I mentioned, we have our dental and vision options. Now, we prioritize your oral and visual health. Our highly skilled team of advisors is dedicated to providing personalized attention to meet your specific needs where that's concerned. Then our COBRA insurance alternatives for individuals and family. We provide viable options for individuals that are seeking healthcare coverage after a qualifying event. And we understand the importance of accessible and affordable healthcare. And our goal really is to help you find suitable alternatives to COBRA coverage. And our experienced team of advisors is dedicated to providing comprehensive guidance and personalized attention to meet your specific needs. Then we have our caregiver support. So, with that, we understand the challenges and responsibilities that come with providing care for a loved one. And whether you're caring for an aging parent, a spouse, or any family member, we are here to provide you with the resources and the guidance you need to make these decisions with confidence. Educational support. So our on-demand educational resources range from webinars to FAQs. We're really committed to empowering you with the information and the resources necessary to make informed decisions and navigate complexities in these arenas, really. Additionally, our services extend to your loved ones. So if you have a spouse or parents that need assistance, they can give us a call, state their name, what their relationship is to you, and we'll put them in our system and take care of them just like we would you. It's really that simple. So, what is Part D? PDP, Prescription Drug Plan. So, Medicare Part D is designed to help cover the cost of prescription drugs, and Part D is provided through private insurance companies that are approved by the federal government. Part D is required to cover two medications for each condition, and it may require prior authorization and or step therapy for certain prescriptions. But Part D is offered to everyone that does qualify for Medicare. It can be purchased as standalone with original Medicare, or in some cases, they are built into Medicare Part C plans. And as far as eligibility, so anyone 65 or older and a US citizen or a legal resident qualifies. If you're under 65, you qualify if on Social Security disability or have ALS or ERD. And you can have Part A only and Part D if you are on non-creditable coverage through your employer. All right, so how are medications covered under the different parts of Medicare? So, medications ordered and administered during an inpatient hospital scenario will be covered under Part A. And some medications administered in an outpatient facility or a doctor office can be billed under Part B, such as infusions, certain shots, and you must confirm with the ordering doctor to determine whether any medication qualifies to be billed under Part B. So, as stated before, Medicare is required to cover two medications for every categorized condition. However, with that being said, the items covered vary by carrier formulary plans. So the items that are not covered by Medicare Part D are any OTC, weight loss drugs, fertility, cosmetic, and erectile dysfunction drugs. Now, there are exceptions in the case of erectile dysfunction drugs when prescribed after prostate procedures, and certain lower dosages may be on some formularies. Now, having an account set up in MID will allow you to run any prescription through your drug plan before it is prescribed, so you will have the cost at your fingertips. So on this next slide, I just wanted to touch really quick on IRMA. So IRMA stands for Income Related Monthly Adjustment Amount, and it's calculated by your past 2 years of annual income as well as your income threshold. Now, there is an option for an IRMA appeal once your income decreases. And this IRMA cost it's a cost that applies to both Part B and D coverage. So one of the most common questions we receive, what is step therapy and what is prior authorization? And how do I know if the drugs I take need prior authorization? So let's start off with the step therapy. So step therapy is a utilization management tool that allows a plan to require an enrollee to try a different, less expensive drug that treats the same condition before it will cover a more costly drug. Then we have prior authorization, PA. So PA is a requirement by the insurance company to approve certain medications or procedures before they can be covered by insurance. And these are listed on each plan's detail page. All right, so more of how Part D works in 2025. So first we have your deductible period. Now this is where you pay full cost of prescriptions, tier 3 or higher, until your deductible is met. Next up we have your initial coverage period. So basically you pay copay based on the tier of the drug. And then we have your catastrophic coverage, where your troop has been met $2,000 only for medications on the formulary at this time. So in the next few slides, we will look at examples of what the coverage looks like with maintenance meds and what coverage looks like with some higher end meds. All right, so next slide up, the medication and formulary tier levels. So the copays are determined by the tier level of each drug. Tier 1 being the least of the categories with $0 or very minimal copay, and then increasing in cost as the tier increases. Each carrier and plan tier, the meds are a little different. So tier 1 generic typically is $0 or a very small copay. Um, Tier 2, which is preferred, minimal copay, typically under $10. Tier 3, non-preferred, full retail until deductible is met. And then we have our tier 4, which is specialty. Now, that's full retail until deductible is met, but full retail varies from plan to plan where that's concerned. All right, so here's a chart here to kind of give us a little bit more of a deeper view. So if any of your medications are not on the formulary, then they are not included in the $2,000 out-of-pocket drug cost maximum. So if this happens, you want to have a conversation with your doctor about alternative medications, requesting a prior authorization, or receiving an exception for that particular medication. And it's important to note here that your deductible, the monthly premium you pay does not go towards the deductible. It's mainly the cost for the drugs that go towards that deductible. And we'll go ahead and leave this slide up for just a moment for you guys to take a closer look. So in this example, we're going to look at how Part D quotes and presents plans based on the drugs entered. So no matter which platform you use, MID, Medicare.gov, etc., once you create an account and enter your medications, dosage amounts, and frequency taken, Medicare will present the plans in order the most comprehensive at the lowest out-of-pocket cost for that year. Then each plan subsequent will increase from top to bottom. So if you choose the first plan, you are choosing the lowest cost plan for the year. Each quoting platform will break down the cost by monthly and by medication as seen in the next subsequent slide. So this slide shows us both your total early year cost breakdown by premium, deductible, and drug costs. So each prescription is listed and along with particular tiers for each drug. Again, this varies by plan, and tiers and prior authorization can affect the way you receive your medications. But as long as you're under 2K, your out-of-pocket drug cost will remain. So I wanted to go ahead and give this example as it applies to 90% of the Part D beneficiaries. So the top portion of the slide shows the breakdown of your costs based on filling your prescription at a retail location versus mail-in. So notice the list of drugs on the left are typical common maintenance prescriptions. The column next to it is the RX full cost. This is the retail cost of the drug by pharmacy. And at times, you will see this cost vary by pharmacy selection as different pharmacies order the drugs differently and get better wholesale costs. So let me stress, don't be afraid to look at alternative pharmacies. Sometimes your local pharmacies can be less expensive than the preferred pharmacies. But what's important here is that you pay at the pharmacy, what you pay in the pharmacy is in the deductible column. So now the RX full cost column for the example drug list here, there are only costs for the tier 3 medications. So in this example, you would never reach the $2,000 deductible in the calendar year. In this instance, you would never reach the catastrophic coverage phase. So this slide simply breaks down the total monthly copays and then breaks down each monthly cost by drug. And this portion of the plan detail does not include premium, but will help you budget. So I want to talk about smoothing for a minute. So smoothing is provided through the carrier's mail order company. Um, you don't have to use the company, but it will cause the cost per month to be more even over the course of the year rather than being so front loaded. You will have to reach out to the carrier, and the information to reach out to your carrier would come in your initial introduction packet. So I want us just to take a moment to look at this next slide. So this slide illustrates how your payments for your medication would look if you pass through each of the three coverage phases. So I'm going to go ahead and leave that up for a moment. So cost-saving resources, we have a few of them here on the screen for you. So when it comes to cost assistance, based on income levels, you may be eligible for partial or full state financial assistance. But if you do not qualify for financial assistance, these resources here will also help cut cost when it comes to Part D. But keep in mind, your Part D plan does not require you to fill all prescriptions through the plan. Quoting all of your current prescriptions allows you to stay aware of the cost if you lost any alternatives to filling your medications. But if you can use any outside resources to save money, you are free to do so. And just to go over the resources right quick, we have GoodRx, which tends to be the most commonly used, the most cost-effective saving option. Then we have BuzzRx, Cost Plus, and the North Drug Store. So here at Transitions Benefit Group, we've created a fantastic tool that will allow you to be in control of your prescription plan. After creating an account, you can log in and check formulary right from the doctor office. When being prescribed new medications, you can add and track your personal medication list so that you can easily access and enroll into the lowest cost plan designed for you each annual enrollment period. And the annual enrollment periods run every year from October 15th through December 7th. And you can access MID directly by going to www.transitionsrbg.com/consultation, or you can go to https://www.transitionsrbg.com/PDP to create an account and add your current medications. So, in conclusion, I just wanted to say that prescription drug plans are vital for making sure people can afford the medications they need. So, we've covered here the important aspects of these plans, like what they cover, how they work, and the costs that are involved. So, understanding prescription drug plans is crucial given the complexities of the healthcare and the increasing prices of medications. So, with all that in mind, I just wanted to thank you for joining the webinar today. I hope that we were able to give a lot of valuable information. I know it was a lot. But again, if you have any questions, please feel free to reach out to us. Do not hesitate. That is what we are here for. This is at no cost to you. All you have to do is simply book an appointment online or just give us a call to make an appointment for you. It's free over the phone consultations. You can contact us by our phone number at 1-800-936-1405. or you could set up an appointment at www.transitionsrbg.com. And again, I just wanted to stress this is a free resource service to not only you, but to your friends and family as well. So if any of your friends and family have any questions, all they have to do is give us a call, mention your name, and we'll provide them the same resources, service, and guidance that we provide to you as well. So again, thank you so much for joining today. I hope we provide a lot of great information, and I hope you guys have a wonderful day, and we look forward to speaking with you. Have a great day.